It's with great pleasure that I welcome you back to this last keynote session for this day. I hope you've had a stimulating day with a lot of different great sessions throughout the day. And it's my pleasure to introduce this keynote on nurturing partnership, strengthening care for every child's development by Dr. Kate Milner. The global strategy for women, children's, and adolescent health and sustainable development goals aim to ensure that all children are supported to thrive or reach their developmental potential. However, there are many challenges in implementation, and investment in innovative interdisciplinary partnerships is needed to turn this goal into action for the estimated 53 million children worldwide who live with disabilities. The EACD recognizes that childhood development and childhood onset disabilities are just two sides of the same coin. And we are taking a very deliberate step to bring the teams and conversations involved in early childhood development and the EACD community together. This partnership is essential and I hope will be fruitful for future collaborations. A little bit about Dr. Kate Milner, our keynote today. Dr. Milner is a practicing developmental pediatrician in the Department of Neurodevelopment and Disability at the Royal Children's Hospital, Melbourne. She is also a postdoctoral research fellow in global child health and disability at the Murdoch Children's Research Institute. Her academic work is with teams in diverse settings and has a strong emphasis on improving equitable developmental opportunities for all children, including children with disabilities in low and middle income countries. Between 2016 and 2019, Dr. Milner worked with Professor Joy Long and the team at Maternal Adolescent Reproductive and Child Health Centre at the London School of Hygiene and Tropical Medicine. During her time at LSHTM, Dr. Milner coordinated a multi-country evaluation of early childhood development projects across 23 countries within the Grand Challenges Canada-funded Saving Brains portfolio. Dr. Milner also worked as a consultant to the WHO during the Zika pandemic between 2016 and 2017 as part of the Zika response team. She developed resources to respond to the needs of children and families affected by the Zika virus syndrome. Her doctoral research, which was with the University of Melbourne in 2020, focused on understanding and improving neurodevelopmental outcomes for high-risk neonates in Fiji, a middle-income country in the South Pacific. Kate's current research activities include implementation research to strengthen early childhood intervention for children with disabilities in Fiji and the Pacific through the USAID-funded RELAB HS Consortium, a multi-country study of developmental monitoring and early identification in routine health services in Bangladesh, Nepal, and Tanzania, led by the London School of Hygiene and Tropical Medicine, and a caregiver support program for young children with disabilities in Afghanistan, funded by Grand Challenges Canada. During the COVID-19 pandemic, Kate has also been adapting and testing remote models of support for families for children with developmental disabilities in Melbourne. I think Kate is a wonderful example of how global collaboration can make differences in our field. And therefore, it is with great pleasure that I invite Kate to deliver this EACD keynote address. The floor is yours, Kate.
Thank you very much to Arnab and the organising committee for inviting me to present today. It's a real privilege to be able to do so. So I'd like to say hello to everyone from Melbourne, where it's quite late into the evening or the early hours of the morning. This far into the pandemic, there are a few things that would get me up and online to present. but this is certainly one of them. It's such an important area, and it's such a privilege to be able to present to you today. And I would like to just begin by acknowledging the traditional owners of the land where I'm coming from today, the Wurundjeri people of the Kulin Nation, and just acknowledge traditional owners and elders past, present and emerging, knowing that there are multiple reasons why children can have developmental disadvantage, and including indigeneity. I'm also presenting work that represents, as Arnab indicated, several collaborations, particularly collaboration with the London School of Hygiene and Tropical Medicine Saving Brains Evaluation Team, led by Professor Joy Lawn and others, and closer to home, our project team in Fiji, participating children, caregivers, families, the Fiji Ministry of Health, Frank Hilton Early Intervention Centre and Murdoch Children's Research Institute. By way of outline, I'm hoping that my presentation today will reflect back and bring together some points I think that multiple people have made throughout the day, and potentially join the dots between some points. In particular, as Arnab indicated, it's really pleasing to hear how the commitment of the EACD to making and enhancing the links between global child development and global disability, and I'll speak a little bit to that context by way of framing my presentation. And then I would like to just offer 5 reflections on nurturing partnerships to strengthen care for every child's development, linking to work that I did with the team at LSHTM through something called the Saving Brains Portfolio Evaluation, as well as a couple of additional points from our work in Fiji. In doing this, I would acknowledge that I'm an early career researcher, and this audience is filled with many professionals who are experts in their fields, who have led large-scale multi-country partnerships, and in that way maybe much more I guess, credentialed to present on this than me. But I hope what we can, what I present today can bring an angle, as Arnab said, sort of making some connections between global child development and disability, potentially a bit more of a focus on low and middle income countries where most kids with disability in the world reside, and a particular focus on what we can do at scale. So by way of context, I think this was touched on in the GRDDC session as well. So we know that in terms of global estimates of children who, for a range of reasons, including disability, but for many other reasons such as poverty, extreme stunting, exposure to trauma or undernutrition, that over 250 million children worldwide fail to reach their developmental potential. There have been 3 Lancet series over a decade or so around that, increased understanding of the evidence of a range of interventions to promote child development at scale, and the case for investment in child development is clear. As Professor Bolasanyas mentioned in her presentation earlier, the SDG 4.2.1 Sustainable Development Goal, which the United Nations committed to in 2015, aims to promote and enable all children to have access to what they require to reach their developmental potential, but does not specifically mention children with disabilities. However, in 2018, there was the launch of the WHO and UNICEF Nurturing Care Framework at the World Health Assembly, which really was quite a landmark policy framework, thinking about strategically at a policy level what every child needs to thrive. And you can see on the right the graphic that goes with that framework, thinking about interventions in health, in nutrition, in terms of caregiving, child safeguarding and opportunities for early learning. But there are still major, in spite of the progress, there are major challenges in child development more broadly. And I'm really just going to focus on one of those today. But there are many challenges in sustainable scaling of evidence-based interventions, challenges with measurement, and then obviously we're very aware at the moment of systems disruptions which threaten our progress. So the COVID-19 pandemic, but also climate change and other humanitarian crises. But the particular challenge we're focusing on in this keynote is strengthening care of children with developmental vulnerabilities and particularly disability. So as the work of the GRDDC points out, providing global estimates, 53 million children, or roughly 8% of the world's population, the majority of whom live in low and middle income countries, have developmental disabilities. And those children are at increased risk of mortality, morbidity, poorer access to healthcare and education than their typically developing peers. They are also, we know from multiple humanitarian crises that have gone before, differentially vulnerable to the indirect impact of the pandemic and other global health challenges. So we have many challenges if we wish to deliver on the SDG promise of every child thriving. On the right, I think it's your right, there's a graphic which I've taken from the Nurturing Care Framework, which highlights the care that all children need nurturing care, but children with disabilities and other developmental vulnerabilities require some additional care. Yet that's the policy framework and the conceptual structure for what's required, but there's a major gap in evidence to inform programming at scale in low and middle income contexts. So again, as Professor Olasanya was saying before in her presentation earlier, what will it take to deliver on the SDG challenge of enabling every child to thrive, and particularly children with disability? Is it just aspirational? Well, it was delightful and really encouraging to hear more about the EACD accountability framework for prioritising timely support for children with developmental disabilities. But I think the role of partnerships is crucial to any progress towards this. Every day in my clinic, I see children with a range of developmental disabilities. And when I think of the effort that is required to try and overcome barriers for an individual child's inclusion and participation in family, educational and community life, the challenges are substantial. This is a picture of a little girl called Vanessa in Vanuatu being taken to school by her dad. If we're to overcome these sorts of challenges to inclusion for children with disability in health and education, we definitely need to work together. So I think it's all about partnership, and I'm sure there are many different definitions of partnership, but I think in a very simple Oxford Dictionary approach, a partnership is an agreement between people and or organisations to work together. And I think we're all sort of on the same page that partnerships are where it's at today. And now I'd like to offer you some reflections from the Saving Brains portfolio on strengthening partnerships. So the Saving Brains portfolio was a portfolio of early child development, so not specifically disability-focused projects funded by the Canadian government through something called Grand Challenges Canada between 2011 and 2016. And at the time, it was a major investment and the largest investment in EACD innovation, early child development innovations in low and middle income countries. And we looked at 39 early child development projects across 23 countries, 34 of which were at seed or proof of concept stage, and 5 which were much larger transition to scale projects. So I think that potentially speaks to some of the questions that were asked in the earlier session on chemistry for successful partnerships about what does it take to take projects and programs to large scale. And that was really what we asked in our evaluation of this portfolio. And the projects within the portfolio were all aimed at improving brain development in the first 1,000 days of life through prevention of brain injury, promotion of stimulating and responsive environments, and protection from developmental risk factors. So I've said that the evaluation was led by the team at LSHTM, and I was privileged to help with the coordination of that. And really our focus within the evaluation was to try and take the perspective of a policymaker or a programmer working at national or large scale within a country, and if they wanted to design and implement an early child development program, what were the decisions that they needed to make, and what could we learn from evaluation of this portfolio towards understanding what those decision makers needed. So it was a mixed methods process and impact evaluation, and I've just put a little link there to where you can access the full series for further details. But it was a big collaborative effort with over 30 authors from 20 institutions across 14 countries. And it was an amazing opportunity to speak to lots of people involved in this field and gain from their wisdom. So what did we learn about partnerships? Well, I think it was mentioned earlier on today that really partnerships are about bringing people together towards a common goal. And you'll see that we sort of looked at multiple stages in a program design cycle. And really the first thing that you'll see above that red little shape is that, you know, people come together on a project towards a particular goal and aim, and usually aim to, you know, is the process of defining those. But then the next thing really is about who's going to lead and who's going to partner on that project. And I'm not going to speak about leadership today, but I believe that, as people have said earlier, it is also crucial. So what we learned, number 1 out of 5, was that complex partnerships are the norm, and that partnerships are critical to all phases of intervention, design and implementation, but that partnerships develop over time according to shifting goals of the project and program. So that when we looked at small seed projects, the implementing team often consisted of implementers in country plus technical experts. But then when projects were transitioning to scale, that the project partners were more multi-level, often built on really long-standing relationships. And I think that's really important. Good things take time, including good partnerships, and that those partnerships often involved a range of players from community, government, non-government and academic institutions. And I think it's really important for people like myself who might have technical expertise to acknowledge that in that sort of scaling up process, a whole range of other skill sets become crucially important to the scale up process. There was an acknowledgement of the role of both government and private sector for different purposes, and an endorsement, but with only some examples about how to really engage family and community in the process. And I'll come back to that with our Fiji exemplar. And within the Saving Brains portfolio, we looked at partnership with the disability sector was relatively lacking, but has increased in subsequent Grand Challenges Canada funding rounds. We also learnt that strong partnerships require specific investment in time to establish, sustain and govern, for professional development of people involved in different roles within the partnership, and funding. I think funding was again mentioned in one of the earlier sessions, but funding beyond short-term project cycles was considered crucial to sustaining partnerships and the work related to them. I'd like to point out just briefly, I think this is a real challenge for scaling childhood disability interventions within or programming within the global child health, is that the investment in childhood disability within other investments for child development is low. And I don't have time to go into this, but if you'd like more details, you can look at our 4th paper in the series, which really showed that 2% of donor investments related to early child development for a particular period of time by the EACD was at 2%. We also learnt that local leadership development is crucial, and I think this is really something for us to be mindful of as international academies and professional organisations increasingly and pleasingly have a more global focus, that the emphasis on South-South networks to promote leadership and inclusive early child development is crucial. And one of the strengths of the Saving Brains platform was the peer networks and communities of practice. I think that developed around it at the time. And there are ongoing examples of this, such as the Early Child Development Action Network. I think the community of practice related to the International Centre for Excellence in Disability, hosted through the cerebral palsy community of practice by LSHTM, is an excellent exemplar. I think also as we move forward, allied health, there are also sort of examples of allied health professional networks and communities of practice, which are also crucial. So just, I'd like to move on to sort of think about reflections from other projects, and particularly the project that I'm sort of most directly involved in Fiji. And I highlight this particular one because I think it's an example, and I know that there are many other examples from different parts of the world and at scale, but this is the one that I've worked on longest in my home region, related to caregiver support in diverse settings. So it's called the Fiji Tosovata, or Moving Together Caregiver Support Program. And I think what we've learnt through work in Fiji with colleagues in Fiji in the Ministry of Health and the Frank Hilton Early Intervention Centre over the last 10 or so years is just really the transformative nature of engaging families and communities. And in the last several years, building on doctoral research that I was involved in, we've been able to move forward with a local adaptation, excuse the typo, of getting to know cerebral palsy. And I think many of you will know that that program has had many iterations around the world. Again, LSHTM and the Ubuntu Hub are sort of hosting multiple versions of that at the moment. So it's nice to be able to bring that back from the UK and work with colleagues in Fiji to think about how that could be adapted to the Pacific. And so we did a pilot research, pilot formative research of that in 2019, which was around exploring the feasibility and acceptability of an adapted program for children with cerebral palsy in Fiji and their caregivers, including not just mothers, but also fathers, aunts, and adoptive caregivers. And I just highlight that we used the qualitative method called photo voice to really, as we move forward through this pilot, to try and capture participant experiences of the program. And so through this method, participants took photos to represent what participating in the Tosovata program meant to them. And handily for us, they also, as a group, did their own thematic analysis to represent their collective experience. And I'm not going to go into all the details today, I don't have time, but basically the families identified 3 themes to describe their perceptions of the acceptability of the program. And those themes were happy, bonded together, and confident. And the little girl who I showed the photo of on my initial slide was one of the participants in that program, and her mother wrote, "With Tosovata, using communication cards has helped her choose the things she wants. She has started to say a few words. Having seen her do this makes me believe that as we involve ourselves with our children, it helps them grow and understand that they are loved and appreciated every day." So I think in the Tosovata program, like in many of the seed projects in the Saving Brains portfolio, we're now moving to try and further adapt scale, although it's not even really scale because it's just still a very early stage, the program, including health worker training with caregiver participation and extending existing partnerships. And we were sort of delighted that in spite of the challenges of COVID, we've been able to join a consortium called Learning, Acting, Building for Rehabilitation and Health Systems, or RELAB, to move that work forward. And I think that will be an exciting international collaboration through USAID, Johns Hopkins and University of Melbourne. So number 4 was the crucial importance and transformative power of engaging communities and families. Number 5, which I think probably doesn't need too much reiteration in the middle of the pandemic, is just the importance within partnerships of expecting the unexpected. These are photos of the early intervention team in Fiji going about their early intervention business. You can see on the left is a facilitator who's one of his main roles at the moment is now delivering food to families who have been in lockdown. The middle photo is of two people within the early intervention program delivering a wheelchair to a child in a remote community during a cyclone, and obviously the team got bogged on the way. So I think we're learning in the pandemic, and what many of our colleagues in more diverse settings already can teach us about the importance of just keeping on through many, many challenges. But I think also, what I try to encourage teams I work with and people I work with to do is just also remain open to the positive unexpected as well, because I think through all of this, it's just been very humbling to see colleagues keeping on in spite of these challenges. So in conclusion, I think there are many challenges to really meaningfully enable children in diverse settings with disabilities to thrive. Progress towards these collective goals require effective multi-level partnerships, which includes partnering with families and communities, which is transformative, as well as investment in frontline leadership in diverse settings. And that it's important to expect and plan for complexity, invest with time, funding and other resources, and expect the unexpected, which can be challenging, humbling, and sometimes amazing. So thank you again for the opportunity to present today. This picture is of a picture when I look out my office window in Melbourne, and we are in lockdown, but when I go to the hospital, I look out and I've seen this mural on the building next to us emerge over the previous number of weeks, and it's called Together, and it's by 2 local Indigenous artists. And it's just a reminder that even though we're meeting remotely, we are together, and we very much hope that in Melbourne we'll see you in 2022 for our Better Together conference, which is the conference of the Australasian Academy of Cerebral Palsy and Developmental Medicine, as well as the International Alliance of Childhood Disability. And so if you manage to come to that in person, please reach out, and it would be lovely to meet you.
Thank you very much, Kate. That was so powerful with those messages. And I love the last slide and that mural on that building. That's wonderful. And it captures all that we've been trying to capture through the day, which is coming together. And hopefully all of us will be there in Melbourne in person. We're just keeping all our fingers crossed. So we've got a few minutes for questions, if anyone would like to focus on questions. And while we take questions, Kate, in the earlier keynote at the beginning of the day, people talked about a whole range of different things, but what came out, one of the key things was about relationships within teams and within partnerships. And what has been your experience?
Yeah, I agree. That's absolutely crucial. I think that's why I am presenting at, past midnight in Australia, because that's what I'm passionate about. I think for many of us, that's the most rewarding part of what we do. And yeah, so I think it's something that takes time to foster relationships, and it's easy to come up with truisms, but I think good things really do take time. And say, for me, I've obviously presented the Fiji work because that's where my closest friends and colleagues are, and it's an area that we work on in institutionally. But the people I work with in Fiji really have become, very, close friends and as well as colleagues. And I think one thing that I haven't touched on in this presentation, but I think has been made really clear to many of us during the pandemic, is that everyone goes through periods where they have more or less energy or more or less ability to give to projects, and all of this is endurance work. And so, being humble and realistic, I think when we're at points where we're less able to give, that's where I think the investment in the long-term relationships comes through and keeps us all going.
Absolutely. And I think a true understanding develops when we walk in each other's shoes to fully get that trust, which forms the basis of relationships. Here we have a question. So, Kate, you worked with people from many different countries. Does their different background require a different approach in terms of partnership and collaboration?
Yeah, I think so, and I think it takes a long time to understand different cultures at different levels, and often I'm working in contexts where I'm pretty monolingual, so to really get to know cultural nuances takes a really long time. So I think my general approach to that is really to listen, to try and listen, and to hold lightly to what I might think my expertise is. Because I think we're practicing in developmental paediatrics, we all know that it's so contextually focused, and that the expertise in context, which is held by local partners, is really everything.
Thank you, Kate. Now, we are nearly out of time here, but I'm going to take one other question, which I think is very interesting. So what do you think could be done to improve social inclusion and reduce stigma?
Yeah, that's a big question, and probably not one that I can answer quickly, but I think that's where one area where I think partnership with people with lived experience, and particularly caregivers and family, is huge. And one of the things that I didn't really highlight, but with the caregiver support program in Fiji, and I think colleagues, Callie Tan and her team in Uganda, and the LSH team when they've had caregiver support programs in Brazil, and partnered with people in Brazil, that the response and experience has been similar, that it's the empowerment of families and caregivers I think is a really important and powerful thing to reducing stigma. So encouraging the agency of caregivers and families is one important aspect of that, I think.
Thank you very much, Kate. I'm afraid we are out of time, but you've given us nuggets of really good ideas to take away with us as we go on this journey of making global partnerships. And we hope that there will be lots and lots of global partnerships which will be generated by ideas from today. Thank you again.
Thank you. Thanks.
Thank you.